Thank you, Saujanya, for your kind words. Uh, at the outset, good evening, respected teachers, dignitaries, and dear friends. It's an honor to be amongst all of you at this esteemed gathering. So, let's dive into the topic of artificial intelligence in lung cancer. So, before going into artificial intelligence and its applications in lung cancers, we'll look at some of the use case scenarios. So, as far as artificial intelligence goes, there are umpteen number of use cases in our daily lives, not just in the clinical practice, but also beyond. So, for example, many speech AI, artificial intelligence based engines are actively utilized these days. Some example being NVIDIA Jarvis, NVIDIA Nemo, and Riva. So what do these speech-based AI engines do? A common example these days is automatic captioning as far as YouTube videos or lectures go. So as you all might have experienced, when you go onto YouTube, you turn on the CC tab, you get captioning or speech to text generated on the fly. So similarly, we can also have speech to text generated even as far as radiology reporting happens, as in we can use many voice recognition softwares for dictating reports and generating textual reports based on human dictation using AI based algorithms and softwares. Other system is a recommendation system. A common example of a AI based recommendation system today can be experienced or come across while in certain shopping apps. Say for example, one is shopping on Amazon for a mobile phone. The recommendation system would kick in and would recommend perhaps a mobile phone case or a screen guard. This is another example of AI use case. Then smart cities. As far as healthcare imaging goes, AI based systems can be used for segmentation models or for response prediction models or mutation prediction models as far as diagnostic imaging or even diagnostic pathology goes. Likewise, AI models have been actively incorporated in ADAS systems, that is advanced driver assist systems, in autonomous or self-driving vehicles and cars. So these are some of the use cases of artificial intelligence. And what is the common denominator here in these artificial intelligence systems? The common denominator here is that all these systems tend to mimic human behavior. So something like speech AI, wherein you can imagine a scenario wherein a lecturer is talking a lecture and you are jotting down notes in your book, whereas AI based system is able to generate the caption on the fly from the speaker's talk. Similarly, recommendation based system is nothing but an AI based marketing module which will try to oversell products based on your choice that you make on any of the marketing websites. In healthcare again, segmentation is something which would mimic a human capability of outlining a structure or organ in the human body or any of the imaging modalities, right, like a radiograph, CT scan, MRI, etc. And autonomous driving again is identical to a human driving a vehicle or car on a road and interacting to the adjacent environment in which the humans are interacting using his or her vehicle. So these are some of the use cases of AI. Coming back to AI, which is artificial intelligence. So this term was first coined in 1956 by John McCarthy, wherein machines or computers were designed to mimic human intelligence. A further subset of this technology is machine learning, wherein computers can be trained based on supervised or unsupervised learning to do segmentation models or to make predictions as far as tumor response is concerned, or even survival or disease progression free predictions, or even mutation predictions on certain imaging modalities or even histopathology. Next subset is the deep learning model or deep learning subset of artificial intelligence, wherein the core element of the deep learning unit or deep learning based system are the neural networks. So what are these neural networks? These neural networks are algorithms or softwares which have been developed to mimic a human brain, as in these have multiple so-called neural connections or neural networks similar to the synapses which are present in the human brain, and these neural networks or synapses form so-called multiple in a deep learning based algorithm, and it is these hidden layers which can be used to predict diagnosis from the images which are provided to the deep learning algorithm. Say for example, prediction of a non-small cell lung cancer as a broad example. So there are predominantly three types of deep learning neural networks. These are artificial neural networks, convolutional neural network, which is the most commonly utilized neural network or deep learning based system as far as medical imaging analysis or segmentation goes. So what CNN does is that it is able to segment out the region of interest. In this example, obviously that's the breakdancer, and it can map each of the pixels to the area or region of interest while suppressing out the background or the unrequired information. Likewise, recurrent neural network. This is a more advanced form of neural network which can be used for systems. Say for example, if people are into algo trading in stock markets, that is where recurrent neural network comes into play. So again, as alluded to earlier, machine learning, deep learning. So deep learning is the smallest subset of a larger machine learning, which in turn is a subset of other larger technology, that is artificial intelligence. Moving on to use cases as far as radiology imaging of lung cancers are concerned. So these can be broadly subcategorized into classification-based systems, detection-based systems, systems which can be used for segmentation, or systems which can be used for AI-based denoising and AI-based dose reduction. So as far as classification is concerned, these are systems which can tell you grossly whether a radiograph or a CT scan image is normal or abnormal. And in this example, you can see that an abnormality has been highlighted by this heat map here on the frontal chest radiograph of a patient. Then detection systems, segmentation systems, and dose reduction. So this is an example from the literature wherein on a plain chest radiograph to the uninitiated observer, it can be extremely difficult to pick up this opacity which is sort of silhouetted by the cardiomediastinal shadow along the along the left upper and mid zone. However, by using CNN based artificial intelligence technologies, this can be very well delineated by these heat based maps, and definitely it correlates very well with this mass which can be delineated really well on a CT scan examination. So these are certain areas wherein deep learning based automatic detection techniques can be really helpful or can alert radiologists perhaps towards the end of the day wherein fatigue is setting in, and can help pick up more and more such abnormalities. Next is detection, wherein the AI-based algorithms. In this example, this was one such algorithm which is actually in action at our institute, wherein the algorithm is able to pick up with certain degrees of certainty the various abnormalities which can be present on the radiographs, something like consolidation, 96% possibility, pleural effusion, or even consolidation on the contralateral side. That being said, these systems are not really foolproof. There can be certain fallacies while using these technologies. So one such fallacy is highlighted here, wherein one can appreciate that there's a rounded opacity in the right lower zone, which has been very well detected by this technology as a nodule with the possibility of 50%. However, if one traces this carefully, one can appreciate that this is actually a chest lead, ECG chest lead, which was placed on the patient, which was spuriously detected to be a lung nodule by the detection part of the artificial intelligence or deep learning system. Next is segmentation. So what is segmentation? Segmentation is basically mapping of pixels to a particular class of structure. That structure could be a tumor, could be a lung parenchyma, could be the tracheobronchial tree, could be the vessels in the lung parenchyma, could be the pulmonary arterial system. So by means of using AI-based techniques, typically unit-based convolutional neural networks, automatic segmentation of these structures is possible. And this segmentation is really helpful because these automatic segmentations can be used for what is known as tumor tracking in serial follow-up of patients who would be undergoing treatment for their lung cancers. And in certain scenarios, one can appreciate that these unit-based convolutional neural models-based segmentation can track the response to treatment in patients who are undergoing chemotherapy or radiotherapy for their lung cancer. Likewise, using unit or CNN-based classification systems, even pre-treatment prediction of survival is also possible, as can be seen in this example from the literature, wherein one can see that the area here in the first patient case has been delineated and was shown to predict good outcome post-therapy, which was actually the case at a post 3 months and 6 months follow-up after treatment, whereas in other patients, the model could predict a bad outcome or rather a non-responsive patient. So thus, by utilizing this technology, the clinician can be armed with information whether this patient can end up responding to therapy or will not end up responding to therapy, so that these sources can be efficiently utilized for managing the group of patients who would actually be a group of responders rather than non-responders. Other technique is the AI-based dose reduction, wherein one can have AI reconstruction techniques which can cause reduction in image noise. So this is an AI-based reconstructed model, and this is a clean filtered back projection, wherein we can see that there is substantially less amount of streak artifacts emanating from the dense rib over there, and that is one such use case scenario of AI-based denoising techniques and even dose reduction. So AI-based techniques are to diagnostic imaging, but they also span over to diagnostic pathology, wherein in the busy pathology centers, again AI-based systems can be used for predicting mutations, say for example EGFR mutation versus an EGFR wild status, and it is really important for predicting these mutation status on imaging or even on diagnostic pathology slides, because eventually these EGFR based or molecular alterations would be incorporated into the forthcoming classifications. Moving on to federated learning. So federated learning is a new kid on the block as far as artificial intelligence technologies go. So what is really federated learning? So typically what happens in AI is that an artificial intelligence or a deep learning model is trained on a large amount of data set. The more the amount of data that is available to the AI model, the more accurate the model gets. But that being said, again, it might be really difficult to have such a large amount of data at one single place and a variation in the number of cases. So what can be done is that if a given data is trained at one institute, the same data can be transferred to a client at a different institute, and then the model which has been trained on the data at one institute can be trained on data at several other institutes, and again this model can be further converted into a global model, so that in case there are a certain subset of cases which are endemic to one particular area, and one such case happens to non-endemic place, that case also can be easily identified in an area which is non-endemic. And the other advantage of federated learning technique is that the federated learning technique doesn't really require the data to be put outside the institute, but it is rather the artificial intelligence model which actually goes to the area where the data is present. And data sharing, as you all know, is really a complicated process, and it's not easily available because of the patient confidentialities and other restrictions which are present as far as data sharing is concerned. So I conclude this talk, and I thank you all for your time and attention and patient listening. And I also thank the organizers for this opportunity. I'll be happy to have any queries. Thank you.